Human Metapneumovirus, HMPV. A detailed overview. Introduction. Human Metapneumovirus, HMPV, is a significant pathogen responsible for respiratory infections across the globe. Identified in 2001, HMPV belongs to the Paramyxoviridae family, which also includes respiratory syncytial virus, RSV. It can cause a spectrum of respiratory illnesses ranging from mild upper respiratory tract infections to severe lower respiratory tract diseases such as bronchiolitis and pneumonia. Characteristics of HMPV. 1. Virus family, Paramyxoviridae. 2. Genus, Metapneumovirus. 3. Structure, enveloped RNA virus with a single-stranded negative sense RNA genome. 4. Related viruses, respiratory syncytial virus, RSV, and avian metapneumovirus. Epidemiology. 1. Global distribution. HMPV affects individuals worldwide, with no geographic limitations. 2. Seasonality. Typically peaks in late winter to spring, but cases can occur year-round. 3. At-risk populations. Infants and young children, elderly individuals, people with weakened immune systems, patients with chronic conditions like asthma, COPD, or heart disease. Transmission. HMPV spreads primarily through respiratory droplets and close personal contact. Secondary transmission occurs through touching contaminated surfaces followed by touching the nose, mouth, or eyes. 1. Incubation period, 3-6 days. 2. Mode of spread. Direct, coughing and sneezing. Indirect, contaminated surfaces and objects. Clinical manifestations. Mild symptoms. 1. Runny nose. 2. Cough. 3. Fever. 4. Sore throat. Severe symptoms. 1. Wheezing. 2. Difficulty breathing. 3. Hypoxia, low oxygen levels. 4. Severe bronchiolitis or pneumonia complications. 1. Acute respiratory distress syndrome, ARDS. 2. Secondary bacterial infections. Diagnosis. 1. Clinical examination. Assessment of respiratory symptoms and risk factors. 2. Laboratory tests. PCR, polymerase chain reaction, gold standard for detecting viral RNA in respiratory samples. Immunofluorescence assays and antigen detection. Viral culture, less commonly used due to longer processing time. Treatment and management. Supportive care. 1. Hydration. 2. Antipyretics, e.g., paracetamol, for fever. 3. Supplemental oxygen for hypoxia. 4. Mechanical ventilation in severe cases. No specific antiviral therapy. 1. Research is ongoing to develop antiviral drugs targeting HMPV. 2. Antibiotics are ineffective unless there is a secondary bacterial infection. Prevention. Hygiene practices. 1. Frequent hand washing with soap and water. 2. Avoiding touching the face with unwashed hands. 3. Proper cough and sneeze etiquette, e.g., using a tissue or elbow. Disinfection. 1. Regular cleaning of commonly touched surfaces. Isolation. 1. Keeping symptomatic individuals away from vulnerable groups. Vaccines. 1. Currently, no licensed vaccines for HMPV. 1. However, vaccine development is underway. Impact and public health significance. 1. Hospitalizations. HMPV is a leading cause of pediatric hospitalizations for respiratory illnesses worldwide. 2. Healthcare burden. Significant impact on healthcare systems due to recurrent infections in children and the elderly. 3. Economic costs. Costs associated with hospitalizations, medical care, and lost productivity. Future directions. 1. Vaccine development. Efforts are ongoing to create effective vaccines to prevent HMPV infections. 2. Antiviral research. Investigating potential antiviral drugs to treat severe cases. 3. Public awareness. increasing awareness about HMPV to promote preventive measures. Conclusion: Human metapneumovirus is a critical pathogen contributing to respiratory illnesses globally. While supportive care remains the mainstay of treatment, prevention through hygiene practices and ongoing research into vaccines and antivirals is essential. Raising awareness among healthcare providers and the public can help mitigate its impact, especially among at-risk populations.